I'm a physician in the Skokie, Illinois area. Been practicing integrative cancer care for the last 32 years. You know, my experience is that a healthier patient does better. And that's kind of common sense, but a strategically selected program to the individual issues going on with the patient. What's going on with them uniquely in terms of nutritional needs, physical needs, what's going on with them biochemically. Are they overexpressing certain proteins? Do they have too much inflammation or oxidation in their system? Are the drugs that they're receiving highly likely to cause certain toxicities like neuropathy or cardiac toxicity? So what we like to do is really get an understanding of what's going on with the patient in all of these different areas, and then fine-tune and individualize care to each of these areas for that patient, not waiting until they get these symptoms and side effects, but actually up front to try to really protect them and build a foundation so that they're healthier. We like to start off with the foundational stuff of getting a patient more physically, emotionally, and nutritionally fit, because like any surgeon, the patient's going to do better under those circumstances. So from a cancer perspective, we think fine-tuning their program and laying a foundation is fundamental and the first thing that needs to be done. Then, by having done various assessments on patients, then we can come in and tailor and develop a strategic plan that's more appropriate for their particular needs. I think it's pretty clear from the research that a low-fat, complex carbohydrate diet is the healthiest regimen to go. That too much use of animal foods and saturated fats loaded with these omega-6 fats are pro-inflammatory. They're pro-angiogenic. They support new vascular supply to cancers. They're pro-oxidative. They basically create the recipe for driving a malignancy forward or possibly creating one in the first place. In addition to that, we know that refined flour, refined sugar, a lot of processed foods will drive glycemia up, which will drive insulin up. Insulin has to be one of the strongest growth stimulants for cancer in the body. So correcting that, and the literature certainly supports this, and bringing those down by getting to complex whole grains, complex carbohydrates, not simple sugars, is going to do better for a patient in all regards. So getting this biochemical environment optimized requires the right foundation. It's not enough to pop a fish oil tablet on top of a pool of bad fats. It's not enough to take a little bit of curcumin or green tea on top of a horrendous diet. You need that foundation first and foremost. And then I think it's possible to build on that, depending on what the particular needs are, biochemically, molecularly, and clinically for that patient. What drugs are they potentially going to go on for treatment? What clinical needs do they have? Are they coming in overweight, underweight, weak, fragile? Do they need a program for rebuilding muscle? Do they need one to help tolerate chemotherapy or whatever treatment they need to go through better? And so getting those pieces in place and individualized for that patient is, from my perspective, fundamental. I think there's always hope, and there's always faith, and there's always things that people can do, even under desperately difficult situations. That's not to say that patients' situations are always, easy to take care of or easy fixes by any means, but there's always constructive things that can be done. I've taken patients who have been bedridden, exercised them with their family's help for 1 minute every 15 or 20 minutes during their waking hours. And little by little, not all patients by any means, I've seen patients who have then able to sit up and then get themselves walking around the room and then walking around the floor. And we've taken some of those patients out of the hospital and got them back functioning again. So I know it's possible. I'm not suggesting for a minute that it happens for everybody or that it's easy. But it's possible to rebuild people nutritionally. It's possible to rebuild them physically. It's possible to rebuild them from an emotional and spiritual perspective so that they have the strength and wherewithal to then move toward appropriate treatments. And those treatments need to be the right fit for that patient, for their clinical circumstances, their disease, their treatments. I think that we're missing the boat in terms of care of patients. I think with the statistics from 1950 to today of cancer mortality being improved by less than 5%, that one should look at that and say, we need to be doing something more. That we have to think not out of the box. I'm not suggesting throwing the box away. I'm saying we need to think beyond the box. We need to take the box and say, this is relevant, this is important, this is critical. But how do we take it several steps further? How do we get it more innovative? How do we get patients healthier so that they can respond to treatments better? From my perspective, if we don't do that, we'll be migrating in this snail-like pace for another 50 years. But with what's going on in terms of fabulous research around the country and around the planet, I think we missed the high touch because we got so fixated on high tech. And that if we start to marry these systems, that we'll get patients doing dramatically better, their quality of life will go up, that we know will impact their ability to tolerate treatments, to respond better to treatments, and their outcomes will be better because of it.